Dr. Joshi sir, a stalwart in the field of Ayurveda. Dr. Joshi sir has dedicated his career to the study and propagation of Ayurveda. With his profound insights and vast experience and unwavering dedication to research and teaching, he has been guiding light for many in this field. Dr. Avasthanusara Joshi sir is a distinguished professor and head of the Department of Moderator at Ayurveda Mahavidyalaya Hospital, Hubballi, and has devoted over 30 plus years to teaching and mentoring for both UG and PG students. With a robust academic foundation, he earned his BMS degree with first class honors and later specialized in basic principles through his MD from Government Ayurveda College, Trivandrum. Beyond his teaching expertise, Dr. Joshi sir is a recognized PhD guide, having mentored numerous postgraduate students and actively contributing to research. Sir has published insightful articles and co-authored research on diverse topics, including Ayurveda approaches to chronic conditions and innovative interpretations of ancient principles. Dr. Joshi's contributions extend beyond academics. He has been a resource person and chairperson for multiple national level conferences, organized seminars, and participated in critical initiatives. And Sir has conducted many number of medical checkup camps exclusively on psychiatric illness. His dedication to integrating ancient wisdom with modern challenges had made him a sought-after voice in Ayurveda. So, ladies and gentlemen, please join me in warmly welcoming Dr. Avasthanusara Joshi sir. Now, it is our privilege to welcome the distinguished speakers. Our first speaker, President and Head, Rajan Institute of Ayurveda Medical Sciences and Research Center, Hassan, is a renowned expert in Ayurvedic psychiatry, Manovignana and Manasa Roga, with a deep understanding of classical Ayurvedic principles and their application to mental health. His extensive research and clinical expertise have made him a pioneer figure in this field, so we are very honored to have you here with us today. Dr. Narayan Prakash sir holds a BMS degree with third rank from Karnataka University, Harvard, an MD in Manovignana Evam Manasaroga from Gujarat Ayurveda University, and a PhD from Dr. Sarvepalli Radhakrishna Ayurveda University with over 23 years of UG and 16 years of PG teaching experience. Sir has mentored students in Kali Chikitsa and Manasaroga. A recipient of multiple awards, including the Lagutrai Ratna Award and Best Teacher, Sir has published numerous research articles and authored a textbook on Kali Chikitsa with 3 volumes. Dr. Prakash sir has treated over more than 30,000 patients, specializing in psychiatric, neurological and autoimmune disorders through evidence-based Ayurveda medicine. Renowned for his clinical expertise and academic contributions, Sir continues to promote Ayurveda through practice, public talks and seminars. So dear delegates, let us welcome with a great honor Vaidya Narayan Prakash sir. Our second speaker, Dr. Suhas Shetty sir, is an esteemed clinician and academician known for his profound knowledge of Ayurvedic treatments for psychological conditions. His innovative approaches and dedication to advancing Ayurvedic psychiatry have greatly benefited both students and practitioners alike. Sir, it is honored to welcome you, sir. Dr. Suhas Shetty sir, Principal and Medical Director, KLE Shri BM Kankanawadi Ayurveda Mahavidyalaya, Belgavi, specialized in Manasa Roga, mental health, clinical research and medical statistics. Published 3 books, 76 scientific articles. Sir is a co-investigator of 10 completed and 8 ongoing research projects, sponsored by various funding agencies. Sir is a member of Accreditation Committee, Ayurveda Training Accreditation Board, ATAB, operating under Rashtriya Ayurveda Vidyapita, Ministry of Ayush, New Delhi. Technical expert for national and international policy documents like WHO, NCISM, CCRAS and many more. Dear delegates, please join me in giving a warm welcome to Vaidya Suhas Kumar Shetty sir.
you want to see Guru Shishya Parampara, the live example is here. Hope Joshi sir is senior to Narayan Prakash sir, and he is, I would say, I am junior alumni to him because he is from the same institution where I studied and I am working. Welcome Dr. Narayan Prakash sir, and my teacher and teacher of all, in all respect, senior most Dr. J.R. Joshi sir is here, and Narayan Prakash sir's Shishya, Guru Shishya Shishya. So 3 generations of Ayurveda legacy you can see here, Dr. Suhas, Shetty sir, and all 3 are unique with their own contributions, and you will know with their presentation. Thank you. Over to you, sir.
Gurubhyo Namaha. Hari Om. See, respected the Narayan Prakash sir and Suhas Shetty sir and Dr. Saurabh sir and all the delegates. See, today they have given us the topic Avasthanusara Chikitsa of Unmadha. Here, everybody knows it. The psychiatry in Ayurveda. We have 8 branches. Kaya Bala Graha, Urdhvanga Sharira Jaravasha. Kaya Bala Graha. Next will come Graha Roga. It is nothing but a Bhuta Vidya or Graha Roga or Manasa Roga in Ayurveda. Commonly, what we think, the Unmadha is only the disease which is explained in the Ayurveda as under the heading of Manasa Roga. No, there are many diseases explained under the heading of Graha Roga Chikitsa. What are the Graha Roga? It will come, all comes under the Mano Roga only in Ayurveda. Why it is? Usually, the body is, the Unmadha is classified into 2 ways. One, the Doshaja Unmadha, second one is Agantuja Unmadha. Doshaja Unmadha, based on or predominance of dosha, we have the Chikitsa here. What treatment? The Shamana Ushadi and the Panchakarma Chikitsa. Then later on, the Agantuja Unmadha. For Agantuja Unmadha, we don't have any the Shamanoshati or the Panchakarma here. It should be treated with only Devopashraya and Sattva-Jaya Chikitsa. Sattva-Jaya Chikitsa is only the treatment for Agantuja Unmadha. And as a supportive, as the satisfaction of the patient and the relatives, in many cases we are giving the Yuktiyopashraya Chikitsa also. But Yuktiyopashraya is not having any the much importance in Agantuja Unmadha, whereas in Doshaja Unmadha, along with the Yuktiyopashraya, Devopashraya and the Sattva-Jaya are more helpful. Here, the only usually the Ayurvedic scholars or Ayurvedic the institutions will teach or will study Unmadha and Apasmara are the 2 the diseases which are comes under the Manoroga. But in my opinion, in my practice and what we have seen, that even though the Apasmara is not a Manasa Vyadhi, it is a Sharirika Vyadhi only, in my opinion. Sir will do that later on, they will explain this. Why it is the Apasmara is Sharirika Vyadhi is, the factors which are involved in Apasmara are the Avastika only. Many times, the what are the things are the vitiated, or there will be a abnormality of the mental, the faculties. They will, without any treatment also, it will come to the normal. For example, in Avasthanusara, definition they told. Avasthanusara punaha smriti what is the definition? Avasthanusara punaha Vivaksa Deshtaha. That is one word used by the Acharya, Samplavat. What is the Samplavat? Samplavat, it is not a perversion here. It is not perverted. But whereas in Unmadha, the 9 factors are perverted. Unmadam, Punar, Mano, Buddhi, Samdhya, Dhyana, Smriti, Bhakti, Sila, Chesta, Achara. These 9 factors are perverted. In all patients, all the 9 factors are not perverted. Only one factor is perverted, it is Unmadha only. If Buddhi is perverted, it is Unmadha. If Smriti is perverted, it is Unmadha. Perverted means it requires treatment to bring back to the normal. Lot of treatment, lot of efforts is required from the patient side and physician side. Then it may come to the normal. But in Avasthanusara, Smriti, Buddhi, Sattva Samplava, Vivitsa Chesta, Tama Pravesham Achakshate. That is also only the particular time, particular period only they will get pervert, they will get the abnormality. Again, without treatment also, the Smriti will come to the normal. The patients with the Avasthanusara, they will not lose the Smriti, memory. Memory will be there. When they are in that particular state or particular state of Avasthanusara, they will lose the Smriti, Buddhi and Sattva. Whereas in Unmadha, it will be totally perverted, which requires the treatment to bring it to the normalcy. One more factor, the Buddhi, among these 9 factors, the Buddhi is very, very important. The Smriti is perverted in Unmadha, that can be treated. And the Sattva is perverted, that can be treated with Ahara, Vihara, etc. And Sattva-vajaya and Devapashya, etc. Whereas Buddhi is perverted, it is very difficult. Why it is? In Charaka Sharirasthana he told, Buddhi is an important factor. And Samam Buddhirihi Pashyati. What is this meaning in Charaka is? When the Buddhi is in normal state, the individual is perceiving the things as it is, without any ignorance, without any illusion. The individual is perceiving the objects as it is when the Buddhi is in normal state. Whereas Buddhi is perverted. What is this disease? Buddhi is perverted. What Acharya told regarding this? It is nothing but the disease Atattva-abhinivesha. There is one disease in Ayurveda, Atattva-abhinivesham eko mahagadaha. It is from classical only. Atattva-abhinivesham eko mahagadaha. Why it is called as eko mahagadaha means it is very difficult to treat. Atattva-abhinivesham eko mahagadaha. What is this atattva? Means tattva means as it is. Atattva abhinivesha means what the object is existing. Understanding of object in opposite way. That is known as atattva abhinivesha. Atattva abhinivesha. This disease, atattva abhinivesha, is one of the most powerful and a strong disease in Ayurveda, in a Manoroga Prakarana. Among these 9 factors, Samdhya, Dhyana, Smriti, Bhakti, Sila, Chesta, Achara. Compared to this, the Buddhi, it is very strong. That's why Acharya told Atattva abhinivesham eko mahagadaha. Related to Smriti or Buddhi or other the factors, Acharya has not told much about the description. Here, for Doshaja Unmadha, I told you, this Doshaja Unmadha, Vataja, Pittaja, Kaphaja, Sannipataja, or Vishaja, or Bhayaja, whatever it is, what other factors they told, involvement of dosha, they have their own the etiological factors. Commonly we will study in the classical textbook, the Vata Prakopa, Ahara, Vihara, etc. and influenced by the other factors, external factors, the Vataja Unmadha, and how the Vata will get vitiated and it will be entering into the Manovashratas, Hrudaya, Vidyana. And one more thing I want to tell you, in the Unmadha Purvarupa or Unmadha Samprapti, Unmadha Samanya Unmadha Lakshana, the Acharya explained, Dhi Vibramaha Sattva Pariplavasya Paryakulaha Drishti Radhirataja Abhaddhavakyam Purusham Hridayam cha Shunyam Samanya Unmadha Gadasya Lingam. What is this meaning here? Samanya Unmadha Lakshana they have given. Dhi Vibramaha Sattva Pariplavasya Paryakulaha Drishti Radhirataja Abhaddhavakyam. See here, Abhaddhavakyam means what he explain, what he tell, it will be not in proper way. There will be a not coordination of speech. Abhaddhavakyam. Hridayam cha Shunyam. This is very important. In many Hindi textbook, Hridayam cha Shunyam, they have given as a translation from Sanskrit, they have translated Hridayam cha Shunyam. In English textbook I have seen emptiness of the heart. What is this meaning? I don't know. What is this emptiness? Where the heart will get empty? I don't know. They have translated Hridayam cha Shunyam. Its meaning is the individual or a patient with the Unmadha, he will lose the relationship. That is Hridayam cha Shunyam. He is my relative, he is my friend, he is my the son, daughter, whatever it is. That feeling he will lose. Totally a loss of feeling here. That is Hridayam cha Shunyam. But what is this emptiness? It means he doesn't have any the good relation with anybody, which is relative or friends or the society. Then it is called as Hridayam cha Shunyam. This is Samanya Unmadha Lakshana here. Abhaddhavakyam Hridayam cha Shunyam. Abhaddhavakyam means to whom, where, how to talk. He will lose that concepts. In front of elders, how to talk. In front of youngers, how to talk. In front of the old people, how to behave. No, nothing will be there. He will lose everything. That what we call it as the Samanya Unmadha of patients of any variety, maybe Vataja Unmadha, Pittaja, Kaphaja, whatever it is. Majority this concept will be seen in the Agantaja Unmadha only. That's why for Agantaja Unmadha, the commonly what is the line of treatment according to the condition. Here the Sharirika Vyadhi and Manasa Vyadhi are related to each other. Sattvam anuvidhiyate shariram, shariram cha sattvam. Body follows the mind, mind follows the body. If anything will be the vitiation in the body, definitely it affects the mind. If any vitiation in the mind, its adverse effect will be on body, no doubt. For this, the sake of, even though in Agantaja Unmadha, we have to treat. I told you first only, for the satisfaction of the patients. If the patients come with the buddhi perverted, if you give any rasayana therapy, what is going to happen? Nothing. He doesn't have any the normalcy of his intellectual. How he will take? He will ask many questions. Why I should take? The patients you have not seen. Patient when you come to us, they will tell, why should I take this medicine? What is the use of this? They will ask many questions to the physician only. They will not take. But for the imbalanced state of dosha in certain the conditions, we have to give the some krita preparations or the asvarishta or the rasaushadi we have to give. Then later on, what the treatment is, the treatment schedule important is the sattva-vajaya and the yopashraya only. What is the reason he got this? Usually in the Samhita, with the three intention, the patient or the individual is getting the Agantuja Unmadha. The three important causative factors are Himsa, Rati and Abhyarchanam Cheti. These are the three important causative factors. Himsa, to afflict the injury to the others, to get to make the injury to others. If in a normal state, if I have done this, they will take action. I should become abnormal, I should show my abnormal activities. Then the individual, the others will think he is become a mad. Usually will come like this. Then I should take the revenge. By this keeping mind, by himsa, the some of the individuals are doing. Abhyarchana, to offer the prey from the others. Offering the prey from others. And to fulfill his desires, rati. Whatever he want to get this, if he will not get, in normal state, if it is not possible to get, he starts showing the abnormality. Then everybody is telling, hey, the holy Bada, commonly it will come. Okay, they will start accepting if he is showing the abnormality. With these three main intention, the Agantuja Unmadha will cause the disease. Here, what is the treatment? Many the patients required here the sattva only, not by any Vidyopasya Chikitsa. If you treat with Vidyopasya Chikitsa, no use. In the previous also I told one example. The patients from the nearby Hubli, she was coming and she is telling how the patients should come. Many patients. For example, this one example I will tell you. The patients came with severe pain in the upper extremity, numbness, and she is not able to do the work. If she will lift anything, she will getting the pain, severe pain. Always she will be a slippery mode. She doesn't want to do the work. They have shown all the neurologists in Hubli city, get it all the investigations, reports are normal, even including MRI, other things, what they have done, the major investigations are normal. They have given the medicine for 6 months, no use. After 6 months also, the complaint will be the same. And one day, they came to our hospital for the same complaint. Somebody told, here, Ayurvedic treatment you have to take a better, she will get relief. Already you have tried 7-8 months, you have tried allopathic medicine, she doesn't have any relief, better you try Ayurvedic medicine. Patients came with his relatives. The lady about 27 years old, belongs to Jain family. First question is, what is your problem? I asked him. Sir, I have pain in the right upper limb, unable to do the work, difficulty in lifting the things. These are many complaints she told. And I asked her, since how many years you have this one? Since 8 to 9 months I have this problem, sir. Since 7 months I am showing to the physicians. We have consulted all the doctors and they have get all the investigations. These are the investigations report. But then I what they told. Still they told you doesn't have any problem in the reports. Then why you are getting this problem? If you don't have any problem, then why you are getting this problem? Even though I am getting problems, sir. Okay, I told the relatives, you have to sit outside for 2 minutes. Just I will ask them the 2 questions. Then when you dig in the history of that lady, she told, sir, when before married, I was not doing any work. Here when I got married in the recently, I came over here. We have the joint family. 19 members will be in our house. Since morning 6 to night 12 o'clock we have the work. Many work I should do. When I started doing this, they are avoiding to or they are distributing work to me since 8 months, she told. See, this is the problem. When I started this complaint, I am getting pain, and then they are avoiding, they are not giving any work to her. Then when they told, when they are avoiding you, then again why you are telling me, your pain will be not there. Actually whether you have pain, no sir. Many neurologists they have given the medicine, I have not taken the medicine. I kept ties this sir, I have not taken, but I don't have any pain, but I am doing like this since 6 months only here. Then why it is? Then she told, if I have not done this, they will give a lot of work. When I start doing this, then they are avoiding. Then they will not giving any work. Then automatically I am getting relief. Can I tell your relative, your mother-in-law? No sir, you don't tell. Otherwise again they will tell this. You tell she has some problem, you don't give her to work. Let it be like this only. I will be alright sir. I am not taking your medicine also. Directly she told. Sir, what medicine you are giving? I am not taking your medicine also. Just I will purchase and I will keep it as it is. Many tablets I kept in my cupboard sir in house. Your medicine also. You don't write any medicine. Just you convincing. In what way you are convincing? That is left to you sir. You have to convince our husband and my mother-in-law and my dear relatives. Then gradually it will go. Tell them sir. Gradually it will go, and in what? By your intellect, she only told me, by your intellect sir, how you are convincing my relatives, I don't know, you have to convince them. Then I called the relatives and told, see, you have to give to her, give to work, but you don't give much work. She has some problem with the neurological and but I didn't tell she had psychological problem. If I tell psychological problem, again they will think in some other way. It will be common in Indian tradition. This was. If any psychological problem if you tell, they will start thinking in some other way. She has some neurological problem. This problem will be very rare. Usually in the investigations it will not come. By examination we can understand there is some problem with her. Don't give the heavy works. Give her very small works. After doing some work, she has to take the rest. For a few months, within few months, she will be alright. Sir, medicine, what medicine? She doesn't require any medicine. Even though I will give some medicine, one tablet only I will give, just I will write this. You will give morning and night one tablet for 10 days, then night only one tablet, another for 20 days. Because she is not taking unnecessary, why should I write? Isn't it? She will not take the medicine, she only told. Just for patient relative satisfaction, I have given the medicine. One morning, one night for 10 days, then one only night for 20 days, 30 tablets. Only 25 rupees maximum the prescription. Because I should not lose the relatives also. I know the problems. This is the Archana Kama. To offering the prayer, to offering the love from others, what they will do, that is the Archana Kama. One more, the Rati Kama, to fulfill their desires, they will do. And one more, to afflict the injury to the others, that is Himsa Kama. With these three intentions, the Agantaja Unmadha will be occurring, and Agantaja Unmadha compared to other two, the Himsa, Rati and Archana Kama, this Rati and Archana Kama, the Himsa Kama, it is a chronic and more dangerous the things. Here the patients required many other the techniques, the bandhana, veshtana, what other the treatment they told, Pratidha Chikitsa and other treatment they told for Unmadha, the Himsa Kama or Himsa patients requires these techniques because they have the very horrible symptoms. Many times the patients will, the injury to the others, they will injure themselves by the stick or stone or whatever it is available. By this they will injure to the others who are in front of the patients, or themselves they will injure, and they will go for suicide also. That's why many patients we have seen in our practice, when patients will come like this, for this the technique is required is the Sattva. The important one in 11th chapter, what Charaka told in Sutrasthana, 11th chapter Sutrasthana, the Ishvara Adhyaya, Chikitsa Sutra. Manasam Prativaishi Trivarga Shanmavekshanam Tadvidya Seva Vidyanam. This is the Tadvidya, what we mean. Tadvidya Seva Vidyanam Atma Ninam Cha Sarvashaha. See, morning they have done this, the Pada Puja. It is also anything but Tadvidya Seva Vidyanam. Isn't it? Manasam Prativaishi Trivarga Shanmavekshanam Tadvidya Seva Vidyanam Atmadinam cha sarvasha. See, last point what they told, Atmadinam cha sarvasha. This is very important. Others who are telling, they are ignoring. But in what way we have to prepare the patient is Atmadinam cha sarvasha. Patient has to realize himself. Himself he has to understand what I am, what I have to do. Then in that way, the techniques are told. The samadhi or the Charaka also told, Shishruta also told, the Acharya Bhatta also told many the techniques for Sattva Chikitsa. But stage wise, step wise, one by one, we have to adopt in a patient, and patient has to, finally what it is required is, patient has to develop Atmadinam cha sarvasha, self-realization. He should understand himself only. He should understand what I have to do, how I should come out with this problem. Then only the psychiatric problems will be relieved. Compared to the modern medicine psychiatry, what is the importance of Ayurveda in the field of the Manasarova is, there are two concepts in modern. One, the mitigation of the symptoms and the eradication of the diseases. The mitigation of the symptoms is most common in modern psychiatry. Many patients will come with this problem. See, I was taking medicine since 20 years, 30 years, but symptoms are reduced. No symptoms. He is getting good sleep, he is doing normal activities. When he will skip 1 or 2 days medicine or 1 or 2 days dose, immediately again the patient will start getting the problems. These are the mitigation of the symptoms. Most of the diseases, those that have any chronic state, they will withdraw the medicines by the psychiatrist. That I have not seen, but I have heard this, because they will not withdraw the medicines. Once they will start the medicine, they will not withdraw. I heard this. Some of the diseases, they will withdraw after 10 years of the treatment in certain conditions. Okay. That can be considered under the heading of the eradication of the diseases. But whereas Ayurveda has having the one more concept superseding this, mitigation of the symptoms by Yuktiyopashraya, eradication of the diseases by Yuktiyopashraya by adopting the different Panchakarma techniques, and third one is by adopting the Sattvamaya Chikitsa, the promotion of the personality. That is very important. If you want to change the personality of the individuals, we know the concept, the Prakriti concept. We have to change the Prakriti of the individual. The Sharirika Prakriti cannot be changed. What it will, through born it will come, the same Prakriti will remain till last breath. It cannot be changed. But whereas Manasa Prakriti can be changed by adopting or administering the Sattvamaya Chikitsa, what Acharya has told in different the classes. Alone this is not going to help the what Acharya has told. We have to take the help of the other the text like Bhagavad Gita, Upanishad, Ramayana or Mahabharata, whatever it is. The Grantha from this reference you have to take. See, you know, Bhagavad Gita itself it is the psychotherapy. Isn't it? Commonly what we speak, it is a psychotherapy. What the Arjuna has made and what Lord Krishna told and what happened. Everybody knows it. Isn't it? By taking the help of such the textbook and techniques which are explained in Ayurveda by the Acharyas, combining both the techniques, if you adopt, definitely we can make the promotion of the personality. It means you can change the personality. What personality here? The 16 types of personality it is explained in Ayurveda. That is Sattvika, Rajasa and Tamasa. Sattva, Raja, Tama, the broadly 3. Again Sattva 7, Rajasa 6, Tamasa 3. 16 types of personality. According to that only the individuals are getting the abnormality. Based on the Sattva only the individual get the abnormality. See here, individuals are performing their activities according to the predominant of their Sattva only. When the Sattva guna is predominantly present, we are performing the Sattvika activities and we are getting the Sattvika reward only. If Rajoguna is predominant, Raja activities and reward will be Rajas only. Tamoguna predominance, Tamoguna activities and Tamoguna reward. In Charaka 8th chapter, Indriya Adhyaya, Charaka told this clearly, which Sattva is predominantly present. According to that, the individual is performing the activities. Yad gunam cha avikshnam purusham anuvartante tat sattvam eva padishyante munayo bahulyanusaya. These three qualities are rotating here to get the manoroga. Two important factors, that is Raja and Tamoguna. If the Raja and Tamoguna, by this predominance, the individual get the disease. If you go on increasing the Sattva-guna in an individual by adopting the Sattvika activities, see I told Bhagavad Gita is also required, other texts, why it is. The ahara, what type of ahara you have to take, Sattvika ahara, Rajasa, Tamasa ahara, it is told in Bhagavad Gita, Siddha, Dana, Karma, Kartru, etc. The 12 factors in 17 and 18 chapters of Bhagavad Gita, the Lord Krishna told 12 factors. All the 12 factors have 3 divisions, Sattvika, Rajasa, Tamasa. In what way you have to do? Sattvika, if he is doing the Rajasika only, try to adopt or try to implement the Sattva quality in a patient. You have to tell these qualities, Sattvika qualities. If you go on increasing the Sattva qualities, definitely the individual will become from Rajasa to Sattva, Tamasa to Sattva. One part, the mitigation of the symptoms over by the medication, eradication by Panchakarma or adopting some other techniques, and by promoting with the Sattvika, Ahara, Vihara or the techniques what they told in the Chikitsa, adopting this continuously, the Sattva guna will be peak level it will come. He will not become totally Sattvika, the Sattva guna will become peak level. Raja and Tamoguna it is required. Along with that, the Sattva when it is in peak level, the individual will become free from the diseases. And What is this importance? If once he will reach a peak level of sattva, there is no chance of recurrence of the diseases. Usually in Unmadha also Acharya studied Vigata Unmadha Lakshana. In this also you studied Vigata Unmadha Lakshana. What are the lakshanas are present when the patient is free from Unmadha, Vigata Unmadha? For example, Saramukta Lakshana you have studied. Like this the Vigata Unmadha Lakshana you have studied. No. If you treat with only by medicine or the Panchakarma, again there will be a chance of recurrence of the diseases. When we promote by adopting the Sattvajaya strongly, and when we bring the Sattvaguna in peak level, when we win over the Raja and Tamoguna by Sattva, then only there is no chance of recurrence of the diseases. If you have not done this, patient got relief with this treatment, or what I told, he following this, okay. If you stop the treatment, or patient is not cultivating these things in his life in future, again there will be a chance of recurrence of the diseases. Acharya told Vigata Unmadha Lakshana when to reach, you have to adopt the patient. That's why in the Chikitsa they told Atmadinam Sarvasyaha, self-realization. Patient has to realize in this way he become a normal. Himself he should understand. I should not do like this, I should not take this, I should not do the like activities, everything. To the society, to the public, to the family, to the whatever it is. I should not do this. In that way he has to realize. When he will realize in this way, peak level when he will reach, then there is no chance of recurrence. Otherwise, this Vigata Unmadha Lakshana what Acharya told, again there may be a chance of recurrence if you are not followed it properly.
Shri Gurubhyo Namaha. Ajnanatimirannasya jnananjanashalakaya chakshurunmilitam yena tasmai Shri Gurave Namaha. Gunatraya vibhedena murtitraya upayashe trayi gune trinetraya triloki pataye namaha. Shri Dhanvantare Namaha. Respected Joshi sir, my Shishya, colleague, friend, Dr. Suhas Shetty, respected Dharmadhikari sir, and my dear Shishyas, Ayurveda, budding Vaidyas. Joshi sir has mentioned about Ayurvedic psychiatry. Ayurveda, though Kalaba, Kayabala, Udvanga, all these Ashtanga Ayurveda, that is the proper scientific classification is there in Ayurveda. But mainly because of the time, many books related to many parts is not available. Maybe it was there, but which is there now, still we are not able to understand that itself. If the other samhitas were there, then definitely it will be a burden on us. Is it not? Yes or no? Because see, simple Charaka Samhita, we are not able to understand completely. Though Dharmadhikari sir repeatedly explains in all the aspects, still only few aspects will enter into our buddhi. Is it not? Not everything. Because Acharya himself is told that it is for the our buddhina. Because all we are our buddhis only. We are not pravara buddhis. Because pravara buddhi person will not require all these things. He will establish like Charaka or Sushruta or Vagbata. He himself will write a grantha. He will himself will practice. But because we are all our buddhis, we require the knowledge from people like Dharmadhikari, Guruji. Okay. In this aspect, some inputs from me on Manasarova. Because see, if you ask people generally, does Ayurveda also have Manasarova or psychiatry? This is a common question. And even I think MDs, they know, but still the BMS students of first year, if they ask, they also don't know that Ayurveda also have a branch, that is specialized branch as psychiatry or Graha Chikitsa in Ayurveda. See, by telling itself, Kaya, Bala, Graha is the importance has been given there itself. After the Kaya, the Bala Chikitsa has given more prime importance, then immediately the treatment of Manas, psychiatric elements. In Kaya again, the Unmadha Pasmara has been included. It's not the separate Manasaroga, only not Manasika Vikara or Manasaroga. Whereas in Bala Chikitsa also, Grahas has come. Bala Grahas, a separate entity has been dealt. In total again, Graha Chikitsa. Is it not? So, what is mentioned in Kaya Chikitsa, that also come in Graha. What is mentioned in Bala Chikitsa, that also has come in Graha Chikitsa. So, Graha Chikitsa as a separate entity has established, was practicing, because in the Chhatrapati himself he mentions that Manasaroga Vishaya Parinitasya, he mentions the word. It is where the psychiatrists were existing that time. But maybe because of all these invasions by foreigners, Mughals and the British invasions, this particular branch is there in practice, but not as a separate psychiatrist, because this psychiatric practice has gone to the Purohits or Jyotishis. See, now also in society you can see many Jyotishis, they do Devapashya Chikitsa, they advise for this particular problem of Unmadha, you do this particular Homa, this particular Havana or this particular Puja. The Rahu is now in the 8th house and your mind is not having problems. Problem is because of the Rahu, so do Rahu Shanti. Like that, the Jyotishis advise these all Devapashya Chikitsa now. Have you seen any practitioners advising Yajna, Rudra Yaga to be done, or Dhanvantari Yajna to be done, or Chandika Homa to be done, or Mrityunjaya Homa to be done? Nobody advises, because that knowledge has gone. The Devapashya Chikitsa knowledge, which is a prime importance in Ayurveda, we have lost it. Okay, what we left? Only some Yukti Vyapashya, not that also completely. Sattvavajaya once again, to some extent we do in all diseases, not only in psychiatry, because if the patient is not convinced by your approach, not convinced by your treatment, definitely he will have other options. You have to convince him for your treatment, what he is suffering from, what he has to do. That is Sattva Avajaya. You have to improve his Sattva. It may be in the not only in Manasika Vikaras, even Daihika Vikaras also Sattva Avajaya is required. Specifically the disease like Grahani, where Sattva is disturbed. Because of the disturbed Sattva only the Grahani will increase. The Yakshma or Raja Yakshma and Shosha, where the Manas is disturbed, there also we require Sattvavajaya Chikitsa. Not only that, even the Raktapitta, he explains Sattvavajaya Chikitsa that in Jwara, Sattvavajaya Chikitsa is mentioned. Along with the Devapashya Chikitsas in the Jwara, Vishnu Sahasranama Padana or Aghora mantra patana etc. mentioned as tadvidyasambhasha as well as to improve the sattva also. There also the Vismarana Chikitsa is mentioned in Jwara, Vishama Jwara. You have to make him not to remember that time. That is the Vismarana Chikitsa. The non-remembrance of yesterday had 4 o'clock fever. Today at that time you do some chanting of mantras or speak him, tell some stories, interesting things to him, so his mind will be diverted, he won't have attack. That is Vismarana Chikitsa mentioned in Vishama Jwara. So like that, in each and every chapter, Charaka has mentioned Sattva Chikitsa for overcome the physical as well as mental disturbances. Because even in all physical disturbance also, because mind and body, Deha and Manas are different. Deha is utensil, mind is like milk. If the utensil is not proper, milk will spoil. If the milk is spoiled, utensil also will not remain safe, is it not? So, the inseparable attachment is there in between Deha and Manas. So, one affects the other. So, that's why in all diseases which is explained by Charaka, that you will get one or the other way Sattva Chikitsa also. If you read the Chikitsa Sutras, one or the other way you will get Sattva Chikitsa, and somewhere the Avasthanusara Chikitsa also he mentioned properly. In particular diseases he will mention the Avasthanusara Chikitsa also. And Manas Roga explains Sharirasthana, he explains the Manas completely. Sharira is not Sharirasthana, it is Manosthana. Is it not? From Katida Prishiya up to 6th chapter, which is Purusha Vichaya. Purusha also there explains Atma only. And next Sharira Vichaya he starts explaining physical. Till that 5 chapters, 6 chapters he explained only Manas. And if you read all these 6 chapters properly and understand, then you can understand the Manas and Atma. Because to bring the normalcy, Samadosha Samadhischa, Samadhatu Madakriyaha, Sama, not Sama. It is very prasanna, then you should have used the Sama word, is it not? For dosha, for dhatu, for mala, he used the Sama word. But here you are not bringing the Manas to Samavastha. Because Manas doesn't have Samavastha at all. Manas can be in Prasanna not Samavastha. Because either Rajas or Tamas or Sattva will be up and down in every moment of life. When I speak, there may be Rajas domination, and when I do meditation, there may be Sattva domination, and when I sleep, there will be Tama domination. So Manas doesn't have Samavastha at all. These are always, but a peaceful stage can bring to the Manas. That is the Prasanna. That's why he used a very particular word he used. The Prasanna Atma Indriya Manaha. The Indriya, Mana and Atma can be bring to a peaceful state. Okay. And that is where in the Vigatonmada he telling. After Unmadha, and you are telling that this person is normal, that he mentions Prasada Buddhyatma Indriyanam. Buddhi first, Atma and Indhyana Prasadatva. That is, a state of peacefulness can be brought by treatments, different treatments what we mentioned. Okay, it's not the bringing like doshas can be bring to normal state, the dhatus can be brought to normal state, but mana can be brought to a peaceful state. Not a, it is not that peaceful state itself is normal state considered, because there won't be any state that where raja, sattva and tama, all these three are in the same line. Because if that same line is there, then what happens? This is the pradaya avastha. Because see, for the Srishti, Brahma requires the upliftment of rajas and the pradaya tamas, and only the sattva cannot exist at all, because only sattva is a state where nothing is there, like samadhi avastha. But when raja is there, then only the srishti or thinking can be done. You can do some works with the rajas only. Okay, but to maintain the rajas, tamas also required. So the combination of rajas, tamas and sattva, if it is there in normal condition, that is a peaceful state, then that is called as arogya avastha or swastha avastha. Okay, along with the dosha, dhatu and mala, the peacefulness of manas and atma is required, because atma is always a master of it. It doesn't affect by any of these, but it carries along with the manas. Manas is attached to that atma, that's why it carries everything to the next. So whatever you do here, that will be carried to the next generation. Is it not? If you do good punya karma, that also will be carried. And if you do papa karma, that also will be carried, because we believe the punarjanma and purvajanma avastha. So that's why always we have to do the good things, but the attainment of moksha, purushartha chatustaya, chade, dharma, artha, kama, moksha. Everybody is aimed towards moksha, but after how many lives the moksha can be achieved, we don't know, because it is not that in one life we can achieve moksha, because moksha needs the nil balance. There should not be any punya also, there should not be any papas. If the papa is there, you will have janma in different hina yonis, where if the punya is there, you will have the janma in the upper yonis. That is manusha janma. Manusha janma all we have because of the punya karma of our previous janmas. And papa karma, we get birth in other units. That is our atma will get birth in other units. That is what we believe, or what is mentioned in Vedas, Upanishads, etc. Okay. So to start with the Manasaroga in proper, Vidishoniki Adhyaya of Charaka Samhita, where he explains what he explained. Shonitaja Vikara, Shonita Pradoshaja Vikaras. Sutrasthana 24th chapter. Thereafter, after Shonitaja Vikaras, he mentions three important diseases, three important conditions, which are they Mada, Murcha and Sannyasa. What he explains that in the Mada, Murcha, Sannyasa, the Nidana, what he explained for the Mada, Murcha, Sannyasa and treatment, almost the same goes in the continued in Unmadha. Madha is the previous condition, whereas Unmadha, Madha goes to higher state. Increased Madha is Unmadha. Madhayanti Udgatashu doshaha tasmat unmargam agataha. Sushruta explains. So, Madha is the condition where doshas are increased, and if still it increases, that results in Unmadha. Okay. The Nidanas, what he explains there, is all Shonitaja Vikara Nidanas. And even in the Unmadha Nidana also, many of the Nidanas he repeated there in the Unmadha Nidana. In Unmadha Nidana, he starts with Dhiruna. Dosharivita Chattara Purushanam Evam Vidhanam Kshipram Adhinidvartante Tadhyata Dhiruna. What Dhiru? Some personalities they are having fear complex inside from the childhood itself. Some are, it's not extroverted or inward. They are having some fear complex. Fear towards, in females it is very common, the fear towards lizards, snakes, etc. That is inborn fear complex which we have. Prana bhaya is surveyed for everybody, it is there. Is it not?